Welcome back to the program, Dr. Mielke.
Thank you.
All right, we're talking about hormones, and we all know when the hormones start raging, they get our attention.
That's right.
When do we realize that our hormones are out of balance? What are some of the signs?
Well, some women have hormone problems even early in life, even in teenage years, and of course the classic example of that is PMS. And some women just have a little bit of irritability or just feeling a little down the day or two before their period, but some women have really severe symptoms, major mood swings, and it can be actually incapacitating for some women. And most doctors will treat that with special drugs like antidepressants, anti-anxiety medications, and sometimes birth control pills. But for many women, all they really need, even at a young age, is a little bit of bioidentical progesterone right before their period, and it evens all those symptoms out and they feel much better. And the natural bioidentical progesterone is much, much healthier.
Okay, so I like to call it the hormone monster. You know, at that time of the month, what is it, bloating, water retention,
right,
crankiness, as you say, mood problems. Now, when they're treated with antidepressants, is that really treating the problem or just one of the symptoms?
Yeah, see, I always say if it's a hormone problem, we should treat it with hormones. And especially bioidentical hormones, it's important to understand that there are bioidentical hormones and then there are fake hormones. So the fake hormones are drugs, and those include birth control pills and of course other hormones like Premarin. So these are not natural human bioidentical hormones, and those are the only kind of hormones I think that women should take.
All right, I don't need to tell you this is a controversial topic because you did already address the fake hormones. We'll be really mining that one a little later on in the show. But this whole topic has been popularized by Oprah.
Exactly.
She was on the hormone replacement therapy bandwagon, not fake hormones.
Right, bioidentical.
And Suzanne Summers.
She's written many, many books on this, and one of the ones I recommend people read is called The Sexy Years, and that's about menopause. And so anyway, she talks about it. She of course looks great. She's in her 60s, looks great, feels great. She had breast cancer and is actually treating with estrogen and progesterone. These are things that you actually aren't even, the most OBGYNs don't recommend, and oncologists don't recommend taking estrogen after you've had breast cancer.
Okay.
But many people do.
And that's why it's so controversial in her world. But she's still alive today, and she's looking fantastic.
She's thriving, yes.
So, okay, and again, many years ago, I say many, maybe about 10 years ago, when doctors were embracing hormone replacement therapy for menopausal, premenopausal women,
right,
everybody went that way, then they came back. They discovered what?
They discovered that the fake hormones are actually very dangerous. They can cause cancer, heart attacks, strokes, blood clots, all kinds of really terrible things. And so they actually recommended that women should stop taking those kind of hormones. Many women abruptly stopped hormone replacement, and then they really started to feel pretty lousy. Most women, you know, feel bad without having hormones. So what they need to understand is that those risks were associated with fake hormones.
Fake hormones meaning mare urine?
That's one of the fake hormones. So those are horse estrogen. Premarin is horse estrogen. It is not human estrogen. And then progestin is not progesterone. Okay, it's a drug that's progesterone-like, but it actually has many toxic effects, whereas progesterone does not.